Welcome. Thank you all for joining us for the panel discussion on Putting Children First, Building an Anti-Racist Child Wellbeing System. For 27 years, Friends of the Children has been working with children and families impacted by the foster care system, empowering them to reach their full potential through relationships with professional mentors, age 4 to 6 through graduation, 12 plus years no matter what. If you'd like to learn more, please go to friendsofthechildren.org. I'm so pleased to be with you today to share in this important conversation. A few months ago, we held our first in a series of panel discussions about foster care. The pandemic had just hit the US, and there was a high level of concern about children in foster care. Since then, we've witnessed the death of George Floyd, Ahmaud Arbery, and Breonna Taylor at the hands of police violence. Our country rose up in a direct call to address racism across all of our systems. Today, we're taking a closer look at the child welfare system through the lens of racial justice. Some advocates believe we cannot reform our current system and that we must build a new system based on child and family well-being. Others believe systems change is possible because systems are run by people, and we need to change the people and policies driving those systems. I look forward to this important discussion. I'm pleased to introduce this respected group of leaders who've joined us today. Christine James Brown. She's president and CEO of the Child Welfare League of America since 2007. She assumed the leadership role of the nation's oldest and largest membership-based child welfare organization. Prior to her leadership role with the Child Welfare League of America, Christine served as president and CEO of United Way International for 5 years. In 1996, Drexel University awarded Christine an honorary degree, Doctor of Humane Letters. Welcome, Christine. Thomas Lee is the executive director of Friends of the Children Los Angeles. Thomas has been a child welfare advocate for more than 20 years and has been with Friends of the Children for 3. Prior to joining Friends of the Children Los Angeles, Thomas led the Alliance for Children's Rights Opportunity Youth Collaborative, which works with community partners in Los Angeles to create a launching pad for foster youth to overcome barriers to success. Thomas will moderate the discussion with our panelists. Thank you for being here, Thomas. Laurie Lippold is the Public Policy Director for Partners for Our Children at the University of Washington. Prior to joining Partners for Our Children, Laurie was at the Children's Home Society of Washington and the Washington chapter of the American Academy of Pediatrics. Laurie's direct service experience includes working with pregnant and parenting teens, co-running a group home for children and youth, licensing foster and adoptive homes, and providing a variety of services to the adoption triad. Welcome, Laurie. Shrounda Selivanoff is a parent, ally, and birth mother. She is a passionate advocate for child welfare involved with families driven by her own experience in navigating the child welfare system. As the Director of Public Policy at Children's Home Society of Washington, she brings a birth parent's perspective to inform policy, practice, and system reform, and is dedicated to transforming the system to serve families' needs equitably. It is a pleasure to have you with us, Shrounda. Later in the program, we'll be joined by Erin Kelly Seal, the Chief Officer of Expansion and Policy for Friends of the Children, who will be moderating questions from the audience. Erin has spent her career serving as a child welfare leader, advocate, and expert under 3 administrations for the state of Oregon. Thank you all for being here, and now I'd like to turn it over to Thomas Lee to kick us off.
Good morning, good afternoon, everyone. I'm really pleased to be here to moderate this discussion with this exceptional group of leaders. I have a set of prepared questions I'm going to ask all of you, and then we'll open it up discussion for our participants to ask a few questions. A couple of housekeeping tips. First, please submit questions to today's presenters by typing your questions into the Q&A box where you can submit through the call, or you can also join the conversation via Twitter with the hashtags #FosterOurFuture and #RacialJustice. And so I thought we'd open it up with a question to you, Christine. you don't mind, and this of course goes to all of you. It doesn't just have to be one person who responds, but just so we can really go to some of the heart of it. We've known for a long time that the child welfare system disproportionately harms communities of color, specifically Black and brown children. 1/3 of the children in foster care are Black, but they make up only 15% of the child population. By your lights, what specific child welfare policies or practices are driving these racial disparities?
So thank you, Thomas. And let me slightly challenge the question.
Okay.
I think in reality, and I'll talk about this a little later, we really don't know that the child welfare system is doing harm to children or families. What we do know is that a disproportionate number of children of color are in the child welfare system. And we know that despite efforts over the years, that has not changed. That 9 years ago was around 30% of the child welfare population was African American. Now it's closer to 20, 23, and that neither is good. But I want to kind of challenge us to think more broadly than the child welfare system. And the first point I want to make quickly, and I know I have limited time, so I'm going to try to just make bullet points and then we can come back. The first point I want to make is that the formal child welfare system is a subset of society's larger responsibility for the welfare of children. And it has a very specific set of responsibilities that have to do, unfortunately, with investigation and with removal of children, and increasingly over the years with providing helps and support to families. And in fact, we've not been doing it well, but we're in a society that doesn't allow us to do it well. And that's what I want to first start talking about, that the child welfare system itself is influenced by and works within the constraints of our overall society. That's true for a lot of other systems that serve low-income Black and brown children, whether it's the juvenile justice system, the healthcare system, public education system. All of these systems are working within a larger society that significantly influences the work that we do and our ability to do it. And in fact, the larger society has not invested enough time and resources and thought into developing and providing services for children and families. There's not enough services for children and families. And more importantly for me, with my dangerous little bit of research background, there's not enough evidence and research that's been developed to let us know what services work best for children and families in general, low-income children and families, and in particular, Black and brown children and families. We haven't taken information and disaggregated it in a way that helps us understand what works for different children in different settings, different contexts, different neighborhoods. So that's the first thing I really want to lift up, that we've really failed in this country to either invest in children and families or to make sure that when we are investing, we're doing it in a way that really is going to drive improved outcomes for children and families. The second couple of points I want to make have to do with the fact that the larger society significantly influences what happens in child welfare. And I'm going to give a couple of examples. Back in the 40s, the majority of children in the child welfare system were white. They were white because there was not a view that Black children and families were deserving of the resources that at the time were viewed as helping resources. So that's an example of where society's way of thinking about families really had made a difference for who was in the child welfare system. The second thing is how we think about incarceration, how we think about the use of drugs. All of these things significantly impact what happens in child welfare. The fact that so many Black and brown men and women have been incarcerated has driven an uptick in the number of children in the child welfare system. The fact that heroin was viewed as something that should be addressed in a punitive way, and that families should then be sent to jail rather than treated, which was much more of the inclination when it was opiate, because under opiates, it was more white and Black that were being impacted, right, by that particular situation. So those things in the larger society help to drive what the child welfare system looks like. I have a huge concern right now about what's going to happen as a result of this pandemic. You know, I can see the stress and the strain created on families, resulting in lots of families that are Black and brown coming into the child welfare system. Which brings me to a point that I want to make about poverty and the impact that poverty has on who gets served in the child welfare system. Between 75 and 80% of the children in the child welfare system are there because of neglect, not abuse. Our whole system is built around the abuse model. The way we're funded, the way we do our work is all around abuse, not neglect. When the majority of people coming in are coming in because of neglect. And there is a clear link between neglect and poverty. I'm not saying at all that poor people are more neglectful, but the conditions that come along with poverty, whether it's the stress and the tension and the neighborhood you're in, all of those things mean that more and more people who are poor end up, those families are the ones that are in the child welfare system. And so a lot of what our thinking is about what's happened to families because they're Black or brown is exaggerated by the fact that they're also poor. And this country has the worst view of low-income people.
That's right.
You know, when people think about what happened, unfortunately, within tribes, when because children were living in such poverty, the answer was to take them away from their families, right? Was it because they were Native American? Was it because they were poor? Who knows which, but those two things came together and created a horrible situation for families that are Native American as children were removed. So in today's world, and I know I'm running out of time, I want to end with, in today's world, the child welfare system has two roles. It has the investigative and removal role that it was established to do and funded to do, and it has the helping role that it wants to do, and that more of the social workers coming in have a desire to do, and then are thrown by the fact they can't do it. These two things are very difficult to work together because people are distrustful of a system that investigates and removes, and families won't come to that same system for help. And until we get to the point that we can either create two separate systems that perhaps talk to each other, or that we can get people to work together in a different way, both of those functions are necessary. The investigative function is necessary, and the helping function is even more important to avoid the investigative function altogether. So I think as we think about what we do about this system called child welfare, I think we have to think broadly about how we have to influence society. Why was TANF stripped away? That's right. As a source of resources for people in the child welfare system, when we know that poverty was one of the reasons that they came in? Why are we so reluctant to invest more in food stamps and in housing when we know that those are the kinds of things that result in people coming into contact with the child welfare system? So if we focus too small on child welfare, which we need to do in terms of what are you doing in your system, but if we do it at the without also looking at the broader issues, I think we'll never, ever move the needle to the extent that we want to move it going forward.
Oh, wholeheartly. And while you were talking, I was thinking about how everything is connected to everything. A lot of our child protection systems are largely a product of the institutional environments in which they are enmeshed. In fact, you know, when I think about some of the things that you've raised, I think about how rates of childcare intervention are closely tied to the character of our state's social policies. Mm-hmm. How you can create a through line between aggressive policing and criminal justice systems, and how they produce higher volumes of reports of child abuse and neglect. And how we view the poor and how we are providing services to the poor also becomes a major factor in some of these things. And so I think what you've done, Christine, you've teed up the next question for Shrounda. And Shrounda, I'd love for you to continue this on this theme about poverty as well as basic needs. A report by the American Bar Association pointed out that nearly half of families, 47%, who have their children removed from their homes struggle to pay for basic necessities. How does the intersection of poverty, race, and neglect fit into this discussion?
Thank you, Thomas, and thank you, Christine, for all that you just offered in the prior question there. And I'm just going to piggyback off of some of the statements that were offered. First of all, the intersection between poverty, race, and neglect is the discussion. And I think that the way that we frame it is we make the parent the problem and that they're the problem that needs to be solved. And we don't place them in a position to actually even solve their problems, because child welfare doesn't solve poverty. It just creates family separation. Child welfare does not solve housing. It doesn't provide predictable transportation. It doesn't provide food. It doesn't provide job training. It doesn't provide any of that. So the first thing we have to recognize is that poverty is one of the main reasons why families find themselves brought to the purview of child welfare. And until we have the conversation around what poverty looks like and how people want to respond to that, I think, and I only can just, think about my own situations in my own life, right? About what I've been confronted with along the way. And what I can tell you is that when I lived in impoverished, right, I was really stressed. It's stressful to be in poverty. And I think people start to utilize other ways to kind of manage that. So we see the surge in substance use. We see a surge in, effects of mental health. And those are the ways that we handle some of those effects of being in poverty. So what I'd like to do is really kind of look at how do we work with families and how do we actually get them to a place where they can get what they need. And so my position is around strengthening the environments that people live in and our investment in that place, right? We shouldn't be removing children out of their homes to address poverty. It doesn't, you haven't addressed poverty, you've just removed the child out of their home, and it doesn't make much sense. I'd like to just kind of share a story because it really, really just astonished me and really just helped me to see things completely different. I was talking to a researcher friend of mine, and he went and he did some research around a neighborhood that had the highest concentration of child welfare cases. And in there, what he was able to figure out was, they had, of course, the highest rates of child welfare. But what he did is he said, what would it cost at minimum wage to afford housing in this neighborhood, right? In an impoverished neighborhood, what would it cost at minimum wage, or how many hours? You would have to work 83 hours a week to afford a minimum wage housing in this neighborhood. Then he went so far as to see how many people were on public assistance. And you know what the number was? 0. There was 0 people that were getting assistance. So here they're having this high concentration of people reporting, right? Because they're seeing the effects of poverty. What I want to just say is that we have to go in and create the opportunities for people to get out of that. If you had to work 80 hours, let's just say I went ahead and I worked 80 hours. What does that leave my child? That leaves my child alone. That leaves me not being able to produce, to spend time with them doing homework. All of these other things that can have these issues that would bring a reporter thinking that the child wasn't being helped. So I think poverty is the issue. And I think until we make that the issue and not make the parents the problem, but really start to address what poverty looks like in this nation, we will have very to little effect on changing anything.
No, that's really well said. To get ready for Laurie, to bring her in this conversation, You made me think, Shrounda, about how the well-being of our society is proof of our ability to even organize ourselves efficiently. And we also need to thinking about the statement about the stigmatization of the poor. The stigma should be placed on our larger society. If we're a society that has poor people, that's a major indictment of the society and the way it's organized. And so just wanted to plug that in there just to let people know that we're not going to be shy about some of these subjects today. And Laurie, appreciate you joining us today. And I would love for you to just talk a little bit about what we know about communities of color how they have been disproportionately impacted by COVID-19. The economic recession, as well as centuries-old trauma inflicted by the criminal justice system. So how do you see the multiple pandemics we're living through right now impacting the child welfare system in 2020, as well as going forward?
Well, thank you, Thomas. Thanks, everybody. It's wonderful to be part of this, and I could just listen to the three of you all day. Well, frankly, and I'll speak somewhat personally, I think this has been a major wake-up call. I know for myself that it was a shakeup, that it was like a realization that has been there. It has been the reality. But for some reason, it just, one of those things where nod, this is bad, move on. And that's not how it has been for everyone. And we're starting to see more consistently and really, genuinely, the impact of the circumstances, the racism, the racist policies and practices that exist in multiple areas in our society. So I feel like many folks are starting to ask more questions, and the questions are being asked with more outrage, basically, intolerance. We cannot tolerate this. So some of the questions that came to my mind in thinking about this is, how is it okay that over 50% of Black children and their parents will experience an investigation for child abuse and neglect before they reach 18? How is that okay? How is it okay that the majority of accepted referrals are for neglect, as we've been talking about, that we know there's a strong connection between neglect and poverty, that there are historic and current racist policies and practices that lead to higher rates of poverty, and that we really do very little to put resources into true poverty reduction strategies. We don't trust people enough to do what we know is needed. How is it okay that, and I'll talk about Washington State, in Washington State, a TANF grant for a family of 3, typically a parent and 2 children, is $569 a month, and that the average basic rate for a child in foster care, basic rate, is $760 per month per child. And if that child, however, were placed with a relative who is not a licensed foster parent, they could apply for a child-only TANF grant. They'd have to be willing to have child support enforcement go try to collect money from the parent, but they would get at most $363 per month for that first child and closer to $100 for a subsequent. How is that okay? How is it okay that we still have roughly over 2 times as many African American and over close to 3 times as many Native American children being placed as compared to white children? And that we continue to have the disproportionality, although it sounds like it has gotten better. Well, I think we would all acknowledge it's not okay. It's not okay to continue doing this. Why we have been comfortable in letting things go, like giving a pass on ourselves, me giving a pass on myself, I will own my complicity in this. I heard somebody say, silence is compliance. I know we have been working on making policy changes and addressing many of these issues, but not not enough. It was so far from being enough. And I think we need to really take the voices of the people who are involved, the experience of those who have been here. We have to hold ourselves more accountable. We have to put what's at stake for families before what's at stake for states. We are talking about the lives of children and families. And we know that things like liability are big for folks, but we have to shift our priorities around this. I do worry. We're so media driven. And I think, at least I can only speak for myself. Sometimes I get into oh, I haven't heard anything about this for a while on the news. I wonder, it must not be an issue anymore. So kind of that, sometimes that out of sight, out of mind. And if we can get into our areas, our cozy corners, think, okay, well, we've been dealing with this. We can't do that. There is a lot going on. It can feel overwhelming. And I think we have to really hold ourselves accountable to not just stop. This is something that has to continue, even if one might feel like, okay, I'm just going to go under the covers and surface at some point. No, there's no going back under the covers. I think we have been, again, I've seen a lot of positive changes over the years in child welfare. And I think we have a long, long way to go. I do think the movements, we've got movements going on here in Washington State that are not dissimilar to movements happening in other parts of the country. I think it's really great that the similar conversations are happening in so many different parts of the country now. And I don't want to say we have only been tinkering around the edges, but I think when we look at where we need to go, much of what has been happening could fall into that. And we have to stop, and we really have to continue to hold the children and families in front of us, look at what's needed, and make some huge changes to really address those needs.
No, thank you for that. And before we move on to start thinking about what is working and some possible solutions, I'd like to just follow up with some of the things that you just said, Laurie, and this is to all of you to respond to. You know, when we look at our child welfare system, it's almost as if we decided which road we want to take. Is it a socioeconomic problem or is it a psychological problem? If it's socioeconomic, then the solution was to make a major public investment and create universal social programs that also would have equitable impacts on communities that are disproportionately impacted by some of these systems and structures that are in place to criminalize and marginalize Black and brown families. And then also, if it's psychological, then the solutions always entail focusing on the internal environments, being much more punitive to individuals. And one of the things I've always felt that we need to be soft on individuals and really hard on systems. What is it going to take to get the political will to make larger investments for a great society, using historical phrase? What is it going to take in order to get more people to be comfortable to realizing that they also play a role in the larger investment of creating pathways for understanding that poverty and child welfare are uniquely tied together and bound together. And if we're going to make one better, we have to address the other at the same time. Any thoughts from any of you on that subject?
I'll just throw out that, I think when we use terms like systems and departments, right, it's this big entity and it becomes dismissive of the individuals. We are all of us just comprised of people. And each one of us has an ability to have an active role and to make changes and to call out what this is and to participate in this differently. I think when we stand behind the big governmental name, then it removes the responsibility of my own individualized action. And until we actually, each one of us becomes completely clear about what stands before us. And what stands before us is this, right? Plain and simple is you are removing children from their homes from the only thing that they've ever known. And even if, and I say this with the most clear, I'm very clear that there are egregious things that are happening, but what would it look like and what would it feel like for you to have your child removed from you, to not know where your child is, right? That you may be doing some things wrong and that you completely are disregarded as just a human being that has a connection to your child. People need to start to connect to what this would look like for them and what it would look like if they were experiencing this. We need to stop feeling like we can not be responsible for the whole. I am my brother's keeper, which means for me is you are me, right? And I want to invest and love and give to you. And if there's something missing or if there's some need, that call, what I think about is I think about the 7.5 million people who called an intake line, right? To say there's a problem, right? And here I'm gonna call this number and now we're gonna get to the solution. My question is did you ask yourself if you could be the solution? Did you ask yourself if there was a place in you or if there was a different call that you could have made? Could you have reached out to a parent? Could you have reached out to a neighbor? If we could start to mobilize differently and stop looking at the government and start looking at each other as being the answers, we could actually move this and do these things differently. It is inhumane to remove children and to not know where your child is, right? Even if I've done something wrong, it's just not right. So I think people need to connect to what is actually happening. And I think the more that they connect, that they may become activated differently. We are the solution. We are the answer. And until we own that, we will always be in a problem.
That's right. That's right. Hard to teach family values when you remove children from their families. Christine, I want to come back to you, if you don't mind. Can you reflect on child welfare reform efforts to date, particularly those that have the stated intent of reducing disparities for communities of color?
Yeah, but I don't want to lose what was just stated. So I'll answer your question and then come back to it. I think that the most recent efforts to really rethink child welfare have to do with creating a way to give people an alternative to exactly what you spoke of, removing children. There are a number of child welfare entities that have like an economic barrier, if you will, between when the family comes in, if economics are any part of the problem that has been identified, they have to go in a different direction to a different system. And those efforts have made a huge difference for those families, but frankly, bump over time into lack of resources and revenue to provide the families the kind of supports and services that they need. Things like differential response, things like community response are all important, but really don't push it far enough in order to really make a huge difference. And that's kind of, I think, the difference between how I sit here thinking as an African-American woman who has to look in the mirror, right, and say, would I want my child, my grandchild, anyone removed? And the answer is no. And in my heart, I believe that the majority of people in the child welfare system, the workers, feel exactly like I do, right? So I think it comes down to us in child welfare being stronger advocates on behalf of the people we see up close and personal more than anyone else, so that we can do a better job of enlisting them in the solution rather than seeing them as the problem. And the child welfare organizations that are doing that, either through youth or through families working side by side with them, are the ones that are showing the greatest progress. But they are still going to bump into the lack of resources in this country to deal with things that families are struggling with. I spent 3 years on the National Academy of Sciences committee that looked at how to reduce poverty by 50% in 10 years. And there's great ways to do it, but it comes down to the context in which people live and operate. whether or not they were experiencing racism, whether or not they're going to be able to get a house if you give them a voucher because of racism, whether they're going to be able to get, I mean, it's all of that that we need to be thinking about and working on in a much more deliberate and direct way. So yes, there have been efforts in child welfare. They've moved the needle a tiny bit, but listen, child welfare is a drop in the bucket in terms of the amount of money that this country could and should invest in children and families. And I think people love us to be distracted by how we're going to fix child welfare. I'm not saying we shouldn't fix it. I am number one to say we should fix all those things, but we could be distracted by the obscene extent to which this country has refused to invest in children and families. I mean, we don't want to do food stamps. We don't want to do, you know, any kind of thing to support these families. And then we say, why aren't they working? They're working 4 jobs. And then we complain that they're not watching their kids. So my point of view in all this conversation is agreeing with everything that's said, but adding in the fact that we cannot get distracted by focusing on this little tiny thing called child welfare and not recognize that the welfare of children takes a whole lot more. It takes the child, the family, the community, the relatives, and all the other things that are required for children to be successful. I mean, and that's a huge frustration to me because I think they're going to win if we don't figure out a different way to make our case.
That was beautifully said, Christine. Thank you for that. Thank you for that. Shrounda, by your lights, what would it take to transform the system from one designed around a surveillance model to one designed to keep children safe and protected in their homes and communities? Do you believe that the system we have is capable of making that shift? Can it reform itself, or do we need to build something new?
Well, I'm a visual person. I like visual things. And I think about, there's this house on the corner and it was a wreck. And no one came and built a new house on top of that house, right? You would fancy them to be an idiot. You'd be like, what are you doing, right? You'd have to tear the whole house down, right? And they did, right? Parts of the reform, I feel like, are taking that house, right? And then putting new pieces around the house, right? And saying, look, on the outside, it looks a lot better. But on the inside, right, it's still, the structure is still a hot mess. So I don't know if you can transform the system, and I'm not gonna go there. This is what I am gonna tell you. I've been told, you know, I'm in a recovery community, and they say insanity is doing the same thing over and over again, expecting different results, right? So why don't we keep kids at home? Let's just start there, right? Put some money, right? We were just talking about all this money, and it presents itself as if it's not there. It's there, it's just where you want to put it, right? And I think once again, it comes down to that place of race and how it has this insidious way of showing up and saying, we're not going to put money over here with you, but we will put it over here with you. Because predominantly foster care are Caucasians, right? It's not the base of it is not people of color. So when I look at, you know, what we need to do, and I'll tell you, it's a fantastic way to approach this is if you actually kept children at home, right, you would actually have to put time and investment into their parents and into that child. When you remove children out of the home, what happens is you put the investment in with the kid, right? Inside of that foster home with those foster parents, all of that, right? And then me as a parent, and I've navigated child welfare, so I know, right? Unless I'm really got my hand up, right? And I'm the squeaky wheel, you're gonna pay little to no attention to me anyway, with the hopes that I'll actually just go away. So if we actually thought about keeping children at home, it would prioritize and mobilize people differently, that they would be invested in the family, right? One of the issues that happens for families too is, and I don't think we speak about this enough, is that, you know, you remove children, all of the trauma, you know, they go get help over here and I go get help over there, right? And then you bring them back together and you go, good luck, you guys. You got to get healed together. If you're broken together, you're healed together, right? And you have to have those families staying together so that they can build up their resiliency, their trust, their ability to know that they can get through hard times with one another. So keeping families together needs to be paramount. I'm not about throwing new pieces of wood on an old structure. I don't need your training. I don't need any of those things. You've been doing that for 40 plus years and the numbers have remained the same. The system needs something different. And what the system needs to approach it from a place of an investment of children and their parents and in their communities. Because when you remove children out of their communities, right, you break up parts of the structure and strengthening the community. So when you keep families at home, you not only keep that child within their school, within their safety network, you strengthen that community so that when the next member needs some help, right? It's not that they see these fragmented families that have all the CPS involvement. What they see is that they have some CPS involvement, but because they were able to be together, that they got better, right? Or that things were different for them. And then the system that comes in doesn't necessarily have to be this dismantling system, but it's an actual system that brought in some resources inside the home and actually created some effective, substantial change that really meant something for the family. So that's what I think.
Oh, that's beautifully said. No, thank you for that. Laurie, the 2018 Family First Prevention Services Act has been hailed as a set of long overdue historic reforms to help keep children safely with their families and avoid the traumatic experiences of entering foster care. In what ways will that act reduce or eliminate disparities for families of color? And are there any ways that the act may further contribute to them?
Well, thank you. I do want to pick up on a couple of things before I get to that very quickly. One is, I think that's something we have experienced here, and I know I hear about some efforts at the national level that are very comparable, and that is really elevating the voices of people with lived experience. And in terms of holding people, lawmakers, policymakers, quote, systems accountable, I think that has been certainly a shift we've seen here with respect to youth and more youth voice and kind of youth identifying what is impactful and meaningful for them and what they need, as well as parents. And Shrounda is an absolutely amazing example. And we've got parents who are actively involved pushing the policymakers. And I think it is very different when people are talking to folks who really have experienced things, know what they're talking about, to kind of turn the other way. We also are doing a lot with respect to building those collaborations and networks. So I think, Christine, you were talking about how child welfare is a piece. And typically over the years in our policy world, we have said, okay, I focus on child welfare. And over here, I'm involved with this group that's focusing on poverty or TANF or whatever. Or, oh, now I'm working on a couple housing issues over here, but boom, boom, boom. And this is no. That's why we have to start building more of the coalitions and bringing issues from one into another if we're setting our policy agendas. We have a group, through our poverty reduction work group, steering committee that is made up of people with lived experience. And when they were talking about their priorities, child welfare came up. Now that was a group that was really there to talk about poverty. And wow, lo and behold. So, and that group and the voices of the folks involved with that has really elevated the conversation and taken it to a different place. So I'm happy about that. I'm enthusiastic about that. And I think that it is a way that we can kind of shift the whole dynamic. In terms of FFPSA, I don't want to in any way diminish the work that many, many people, the time, the energy, the years that people put into getting that passed. I mean, I think many of us are aware of that history, and only being able to use significant federal funding streams for out-of-home care was something that people have been talking about needing to do something about for a while. So something was done about it. And again, I think that deserves recognition. Right now, I think we're looking at it as, okay, that's good, and it cannot stop there. There are two, I think many of us talk about a couple of the big issues. One is around the limitations that still exist around how the dollars can be spent, and two, the evidentiary standards. So it's, I mean, I know in the political realm, we can't always get everything we want at once, and some things take a while. I think that they're probably, I don't know, I can't say. What I was thinking is, if we were talking about this now for the first time, given everything that's going on, would there have been a greater willingness to create it differently? And I'm kind of, I hope yes, because we are seeing now that it's going to be so limited in terms of what's really needed. In general, we're not investing enough in evaluating. So now we've got a situation, you can only fund these programs that meet these standards, yet all these other services, all these possible programs, if you will, have not benefited from an evaluation that can come into then be on the clearinghouse. So I think what I would really like to see in order to advance this and have it be as effective as possible for children and families of color and all children and families involved, is that we are really pushing to have the dollars, the funding streams more flexible, and that we are really questioning the evidentiary standards that are in there, and we do something about that. I did just read, probably many people in this webinar read this, but it was in a recent article that Paul Di Lorenzo, hopefully I said that right, who's the executive director of the Philadelphia's Children's Alliance, said, a state's family first prevention plan should not resemble a kumbaya moment. Instead, it has to articulate how a state or county plans to build and reinforce a culture based on relentless belief in family stability and support, moving beyond the randomness of services. Listening to families and community stakeholders will help guide us toward a more human-centered design that would become the norm and get us away from programs that are the equivalent of stumbling upon a heads-up coin. So I think that yeah, it's great. A lot of enthusiasm about the passage, and we really cannot take this as our moment. We have got to keep moving and have it actually be effective. I don't think it's too early to start looking at FFPSA Part 2, and we need to go for it.
Absolutely. Well, I'm going to kick it over to Erin. Erin is our wonderful colleague at Friends of the Children, and you've been fielding some questions coming in from our viewers. So Erin, what do they want to hear from our panelists?
There's a lot here, and I know we won't get to all of it. I just want to thank everybody and assure you that we're paying attention, and we will be, if we can't answer during the time we have left, we'll be circling back with you to make sure we get some of the detail-oriented questions that you've put forward answered, and some of the bigger picture questions. We'll try to posit some thinking on that as well. I'm noticing, I'm going to put a couple together here, but there are several people in the Q&A that are curious about the definition of neglect and whether that is key to our ability to create a system of supports for families like Shrounda envisions that doesn't necessarily involve the system becoming involved at that front end. And on the other side of that, you have people concerned that the system not be penalized and that they be able to focus on that issue of safety and protection. So I'm wondering if you all see any idea or any opportunity to sort of decouple that conversation about well-being from the conversation about safety. I mean, Christine, you talked about the two roles for child welfare and their responsibilities, but as we think about the future state and we try to remain hopeful, is there an opportunity there with neglect and still keeping kids safe and the ability for the community to really rise up around a well-being system?
So on the definition of neglect, I think it really varies from state to state. One of the things to look for from CWA coming out very soon is a paper that provides all the various definitions of neglect. But you have, you know, chronic neglect, severe neglect that is moving towards abuse, all the way down to educational neglect, which we're seeing more of because kids aren't going to their Zoom classes, right? So I think that we've got a lot of work to do as a system to better understand neglect. But I also think that you could have two very different systems. I do believe that the responsibility of safety is going to be there. But it shouldn't necessarily get all merged into the responsibility to help parents and to interact with parents and have them be the best they can be. So whether you have to do two separate systems or whether you have to, as you're saying, get rid of one and build another, I think no matter where you end up, there's going to be those two different functions are going to be needed. And maybe they can exist together, maybe they can't. But both of them are needed and important for our community when you think about the well-being of children. But it's a tiny number of people that we need to worry about in terms of abuse. And because it's the only way we think about child welfare, I think it gets all muddy and confusing for people to really have sharp ideas about what we need to do going forward. I mean, for example, somebody, I think, Thomas, you said that if someone is worried, no, Shrounda, I think you said, if someone is making a report in a community, why do they have to call the CPS line? Why shouldn't our communities have other options for families and families have other options for each other? It's that kind of robust community and family owned system that we all should be advocating for. Whether that system can be the same as the child welfare system, I'm not sure, because there's been so much damage done to the image of that system over time. But we want two different things, you know, and we need them both. We need that robust helping, self-help and all of that. And we also need someone to be sure that things that shouldn't be happening to children are addressed.
Another theme in the chat is just kind of getting at, and you all have spoken to this in different ways, whether the other resources that are invested in children and families being wholly inadequate, but also being really siloed and segmented. When you think about that work, and it's, I think, everything from public health programs around early childhood to alcohol and drug treatment and recovery services, to mental health services, to housing, to you know, food stamps, SNAP, temporary assistance for needy families. There are those programs in place, but I think your summary, Laurie, or the summary you quoted about how disjointed they are and reactive is also true. Do you all, if you could wave a magic wand and like Shrounda said, you know, start something new instead of trying to build around what is, what would be different for you? What would you focus on in this new world of supporting children and families to be together and avoid the trauma of removal?
I just want to throw out that I always look for, you know, opportunities, right? Even in tragic situations, because there's always opportunities, right? And I think that currently, even if you have someone that's in crisis, right, who's come to you that needs some help or who hasn't come to you, have you built something around that you can actually do something more than just address the crisis? And so when I think about building the system or doing things different is I want to address your crisis, and then I want to help move you past that crisis and give you something more to move towards. So I'm thinking about one-stop shops, opportunities for people to get help with jobs, getting out of their neighborhoods. I am really clear about this, and I just want to end on this note. This is all about belief systems, and we're socialized, right? We have environmental, societal, and family places of origin that kind of give us these ideas of who we are and what we can and cannot do. Everyone has possibility. Everyone has the greatest potential, including that parent at 35 or that child at 5. And what we need to be doing is investing in families in a place that removes them from always having to work through emergent situations and getting them to a place so that they and their families can have the life and the comforts that we all, you know, we all should be able to enjoy. We live in a world right now, if you look at the homelessness, it's deplorable, and we as a nation should be horrified that people are living like that, and that we are not answering the call to our fellow, right? That is someone else's problem. And so as I see the opportunities that present to me in this work is that let's help people to get out of those places of desperation and get to a place where they can see aspiration and that they can go back and retrieve their dreams, because we all have them. No one woke up one morning and said, I want to be in child welfare. Nobody woke up one morning and said, I want to be in a tent underneath the freeway. Nobody does that, right? There are pieces of their lives that have contributed significantly to them finding themselves in those situations. And we have got to be invested in each other. That, I think, is so important. So I don't even know if I answered that question, but once again, I just think that, you know, we are the answers for one another.
I appreciate that. And I'm just watching the clock. And I know one thing we like to try and do on these sessions is give people the ability to take action around or think concretely. And Shrounda, you just did that in many ways, just challenging us to think about how we are our brother's keeper. I'm wondering if others want to take a minute to respond. There's sort of two parts to this, one or the other, or both are fine. How do we activate with our policymakers and with lawmakers, with people who right now have the power to make change? How do we as a community activate there to establish a different vision, to change mental models, like you just said, Shrounda? And then are there things we should be doing, and you've given some highlights, but I think just to be innovative and to put forward anti-racist approaches to supporting child well-being in our communities. Thomas, you want to start?
Yeah, I'll jump in. I'll just say it starts with how our short, midterm, and long-term goals should be focusing on how we view and treat children and families. We can't treat them like objects. They have, all children, if our policies don't pass the My Child test of what you would do for your own child, then it shouldn't ever become policy. When I think about some of the reform efforts, it's a combination of public health policy, marrying, and being coordinated and working in tandem with social workers, doctors, nurses, teachers, childcare workers, everybody working in unison in a cohesive, unified way. And when I think about, you know, the generation that I came up, you know, children were supposed to be seen and not heard. Well, we need to declare, it's still early in the century, should be the century of the child, where those old notions of how we treat our children are discarded once and for all. And we really place children at the center of our focus. And then, like I said earlier, the way that we view and treat children should be the ultimate indicator of how we're functioning as a society. And if we're not functioning at that high level, then we need to hold everyone accountable that has the power to start moving and changing the investments and how we're building a stronger society as a whole.
Well said. Anyone else want to weigh in?
So I'll say a couple of things. I think that in adult services, there over the years, thanks to the advocacy of older people and all the organizations that work with them, there is a plan. There's a coordinated plan for all senior services that recognize that seniors are going to need a variety of services, right? There's no such plan in this country for children and families. We don't have an overall comprehensive plan that pushes us to recognize that families have strengths that we can leverage, that they're in multiple systems and shouldn't be filling out 20 different forms just because they're in 20 systems, and you can leverage different things. We have not done that for children and families. And I think that would be an important starting point for us to recognize, not to pick off little pieces of child and family services, child welfare and homelessness and other things, but to say we need to really demand a holistic, comprehensive, coordinated system for families and children. And I think until we get there, we're going to look 20 years from now and we're going to have the same conversation again. And as good as the Family First Act is, I'm worried about it because it hasn't addressed kinship the way it needs to in terms of the evidence related in supporting kinship. And we know kinship is an important way to reduce disproportionality in the child welfare system. It hasn't normed all of its evidence against serving African American and other communities. It's destroying or could potentially destroy African American community-based organizations with a demand for evidence and all. I'm not saying this other than to say we have to be very intentional about everything that we do as we move forward, because there's so little money and so little priority in this country for children that intentionality is critical.
Laurie, one quick point from you.
So I think, well, I agree with what has been said. I think we need to listen to families and ask what would make a difference, and then do what we can to provide or help families get that. I think some of us probably have been in places where too many people are speaking for families, and we need to hear from them directly. The other thing is I know here we're embarking upon some policy changes, and we can expect to have resistance. And I think we just have to keep pushing through the pushback that we know we will get. If things were easy, they would have been done. So I think for the resources, the policy changes, everything that is happening now, we just have to stay on it and keep going the course.
Well, I want to thank all of you for joining us today. And I especially want to thank the panelists. You all are brilliant. It gives me great hope to know that you're leading these conversations, both locally, nationally, in your communities and at an individual level. I'm really excited to have had the chance to learn from you today. And I know there are a lot of questions we didn't get to that we look forward to being able to follow up on. I just want to remind everybody, the times of crisis are the times when history is made. There's a huge opportunity ahead for all of us. And I look forward to the work together to make a difference for kids and families and to create this system of well-being that supports them in the way that has been envisioned in the conversation today. So thank you all. Hope you have a wonderful